over 100,000 children. And this is important now, come on. Young people are living in poverty in Merseyside and Cheshire, and 60% of them are in working households. A report out today reveals the impact this has had on health and wellbeing and also their futures. Now, in response to this, local public health leaders have joined up with directors of children's services, the NHS and voluntary sector and others to publish a statement calling for action to end child and family poverty. Well, Dave Bradburn is Director of Public Health for Wirral and Cheshire and Merseyside's lead Director of Public Health for Children and Young People. Well, he told our reporter Jacob Waters what child poverty means.
It's people not having the resources to meet their minimum basic needs.
And not having those resources to meet your basic needs, being in, child or family poverty, what effect does that have on children and young people, both physically and mentally?
Oh, it's absolutely huge. And I think this report really showed the scale of that poverty and the impact, with over 100,000 children and young people under 16 living in poverty within Cheshire and Merseyside. That's much higher than the national average, and it's getting worse. So the reasons are complex in terms of low family household income, the rising cost of living, fuel prices, housing, eating costs have all gone up significantly, and household income of the poorest households haven't gone up to match that. So it places a huge pressure, and this report really highlights some of those pressures as well. And actually, it debunks some of the myths that some of the people who are, or a significant number of people who are living in poverty at the moment, 60%, are from working households. So low pay and insecure jobs is an issue for them. Those increasing mental health problems, as you pointed out as well, and the rising number of people who are unable to work due to long-term conditions and disabilities.
We talk about the cost of living all the time. It's dominated the headlines for the last couple of years. How severe is the problem of poverty for families who are working and on low incomes?
That is probably the key issue that this report highlights, that those that are in work are really struggling to make ends meet and are still living in poverty and are working additional hours just to make ends meet. They are still having to make decisions on whether to eat. So those impacts for people who are in work is absolutely shocking. And I think that's one of the key things that is highlighted within this report.
You're Director of Public Health for Wirral and Cheshire. In your work, especially creating this report, have you got any main challenges that families face that come to mind when you're thinking about it?
Poverty really affects people right the way through the life course. So before they're born, so in pregnancy, it will affect their birth weight. So quite a lot will be born underweight. Early childhood illnesses are more severe. You can see increasing levels of obesity. You can see they have more asthma, much worse poor mental health. They're not able to grow and develop like other children their age. So there's a huge ream of problems that are attached to living in poverty. They then have a knock-on effect into future generations. It will affect people's earning potential, their educational attainment. Unless we break that cycle, you'll get that cyclical process, and that will just feed into families.
Most of us have got a vague understanding that there is some form of a welfare state in this country. There is support for people who are struggling. But is there enough support and help available for those who struggle financially?
The support is in place locally, and people just need to be directed into those. They'll be slightly different depending on which area of Cheshire and Merseyside you're living in. But in essence, Citizens Advice Bureau are normally a very good starting point. And also the local authority, so the council can direct people into what is the best route in to access that support at a local level.
You've come together with other public health leaders and representatives from the NHS, children's services and the voluntary sector to publish a statement on the urgent need to end child and family poverty. What particularly prompted this?
The report was shown to us a few weeks back, and we were shocked by the scale and the impact that it highlighted for Cheshire and Merseyside. So over 100,000 children and young people under the age of 16 who are living in poverty within Cheshire and Merseyside. That was enough for us to say, as a group of directors of public health across Cheshire and Merseyside, and working with our other partners, that was enough for us to say, enough is enough. We really do, even though there's a lot of really good work going on here. And each area will be doing some good practice to try and support these families. But we really need to have urgent action and really understand whether what we're doing is having the impact that we need on those families that need it most.
Finally, you did touch on it slightly there, but what impact are you hoping this statement will make? What action could be taken as a result of it?
We really want people to share the findings of that report, but also to consider how they can help to actually help focus us and contribute to tackling and eradicating child poverty going forward in Cheshire and Merseyside. That will need a whole range of partners coming together. It's not just one single action, but there's a framework within the report that will start to develop that with partners. But basically, that's about maximising household income, supporting children, young people and families, but also building inclusive practices. So making sure that the barriers that are in place currently for some people who are living in poverty, that they can actually access the services that they need, and they can access good quality employment going forward.
That was Dave Bradburn, Director of Public Health for Wirral and Cheshire, and Merseyside's Lead Director of Public Health for Children and Young People, talking to our reporter Jacob Waters there. Just had a lovely message in as well. I'll read that one out later, actually, because that's something that we can probably pick up with Call Kev, I think. 0800 731 9333 is the telephone number to call if you do want to give us a call. And how have you been getting on?